When I think of the integrative medicine offerings, I think of diet. And when I think of diet, I think of maintenance diets and therapeutic diets. And a maintenance diets are individualized for people to optimize their health. Therapeutic diets are diets that try to respond to a particular health problem an individual may be having, and those could be in the realm of neurologic illnesses, gastrointestinal illnesses, musculoskeletal illnesses, neoplastic diseases, etc. We offer nutritional supplement therapy, and as much as we can, we try to make it evidence-based. That is to say, I'm always looking for evidence in the literature for why something may be helpful to a person, what dose would be helpful, and what delivery system would be best. And I try my best to make sure that we move beyond mouse studies to human studies, although that's not always possible, but try to at least allow the patients to become aware of what we're basing our recommendations on and how well they're referenced in the literature. And then we have herbal therapies, and I'm very fortunate to be able to work with Carrie Connell, who'll be speaking with you shortly, who is a trained and licensed herbalist, and where we again can often, through the use of what's called delegation agreements, provide these services via insurance basis. Exercise, which is really so important for people, particularly people who aren't optimally well, to try to maintain muscle mass. It's probably the single most overlooked issue in people who are dealing with age-related concerns and with chronic illness. You can maintain your body mass through a lifetime, but as your muscle mass declines, you become frail and you don't have the reserves to recover from illness and injury. We have wonderful physical therapy services now. We have energetic therapies. I call them energetic therapies. My scientific take on it is that they're therapies that balance the autonomic nervous system, the background nervous system that is like the operating system and hard drive of your computer all at once, and tries to achieve a balance. Once you're balanced, natural healing activities can occur. And then self-regulation therapies that have to do with to use a simple term, meditation type therapies, but they're really, I believe, much more specific and much more effective from a direct therapeutic point of view than the traditional meditation therapies. Next. So in diet, as I said, we have maintenance diets that are individualized for each person, that based on their age and sex, family history, general health history, and special health goals. And I should mention that in any person, when I see them, I'm always thinking of three sort of areas of endeavor. One is rescue. There are people who are profoundly ill and need sort of a very significant amount of attention and intervention. Much of the rescue interventions are conventional medical interventions, whether they're surgery or in people with cancer, the newer types of therapies with cancer, the biologic therapies, etc., and or medication when appropriate for diabetes or hypertension. And then the next phase I always think of is transformation. Once they're out of danger, how do you help create a transformation to a higher level of health? And I always think of health as functional reserve or organ reserve. That you have a reserve capacity, whether it's measured by pulmonary function or muscle mass or brain function, to deal with the stresses of everyday life and then the occasional, we hope, extraordinary stresses that we're faced with. And then there's maintenance concepts where people would like to maintain good health and would like to have some input on how to monitor that. And more I'm trying to come up with ideas that give in what parameters they'll follow and how they'll do that. And I think of it more as a coaching activity than as a medical activity. Next. And then the therapeutic diets designed to support patients with health problems such as obesity, irritable bowel disease, inflammatory bowel disease, celiac disease, diabetes, osteoporosis, cardiovascular disease, neurologic diseases, and neoplastic diseases or cancer. And we have, we're constantly working and evolving those types of dietary programs for people, and they must be individualized because people's ability to tolerate foods varies, their ability to tolerate different supplements vary, and their overall sensibility is different. And then we have the herbal therapies, and we have, it's better than going to the health food store and having someone pick something off the shelf that they think that they read is good. We have someone who really thinks about these things, and the programs are highly individualized, and they're adjusted based on the evolution of the person's health. So what you take in 1 month or 1 3-month period may vary from another period in your life, or the season, etc., or the endeavors of your life. In the exercise area, we with many chronic diseases, and it's becoming clear whether it's cardiovascular disease, pulmonary disease, neoplastic disease, cancer, the frailty issues of aging, that without adequate muscle and bone mass, you can't really maintain good health. And so the gym is available downstairs. If you haven't seen it, I guess we can make sure it's open that people can walk through it. Is available for the benefit of our patients. We have very interesting specialized equipment that facilitates return to full activity and maintenance of high levels of health. So we have a treadmill that unweights the body, so you can walk on a treadmill at as low as 20% of your normal body weight. So when you have an injury or a disability, it allows you to have the experience of a normal gait and progress the weight bearing that you can do in a way that I think is more effective than a swimming pool, because in a swimming pool it feels great, but you don't get the gravitational stress and you don't normalize the gait patterns that are so important. We have whole body vibration, which is a very safe but effective way in helping to maintain core body strength, prevent falls, build bone mass, and in general normalize autonomic nervous system function and reduce the high levels of stress hormones that people have. And then we have a new machine that's coming in another week called Biodensity that's pretty remarkable, because it will, in about 5 minutes weekly, improve bone mass without medication and improve core body strength very significantly, giving you computerized feedback as you go on it. And so that's another addition to our overall programs and offerings that we feel really differentiate us, but really provide great value to patients. So the wellness and physical therapy at Crossroads has special areas of interest. It's our physical therapy. They have orthopedic and sports rehab, and because of my particular interest in age-related health issues, balance and stability training, so with people with imbalance issues, people with vertigo, we have strategies to help with that, between the balance and stability for frailty and the vestibular rehab for dizziness. And then we have a new therapist who's joining us to help in the management of urinary incontinence using pelvic floor training and biofeedback training. And then in terms of energetic therapies, we have lymphatic enhancement therapy, which Pat Casey will talk about. We have acupuncture offerings and people who do lovely forms of acupuncture. There's one lady who I hope will join us soon who does this Japanese acupuncture, which I like because she doesn't have to stick you with needles to do it. She just touches the skin with the needles. And having had it done for me, I could tell you that it works just as well as getting stuck with the needles, so it's really been wonderful. And then we have a vibrational harp therapy that is also a very lovely way of, again, normalizing autonomic function through sound and vibration that you experience. And then we have the self-regulation therapies, which the first one is called open focus attentional flexibility training. And one reason I was attracted to it is that it gives people home activities to do and homework to do. So it's not only about coming here and having things done to you or with you, but you actually develop a sort of a skill that you can apply in everyday life. Brain synchrony training, which is a corollary to open focus training. When there's synchrony between the right and left hemispheres in alpha rhythm, your body can't be in stress, and there's a restorative effect on brain health. The neurooptimal training is a more passive form of EEG biofeedback, but remarkable in its own way because it, if you think about, for me, I think about the difference between complexity, which is on the surface can look chaotic, but is not, is healthful, and in fact, the nature of all of our systems are to have a healthy level of complexity, and in part meaning that you can respond to environmental stimuli and stresses and internal stresses, and then recover. Is that stable? It's not going to fall on our head? Why don't you move away from that so we shouldn't, yeah.
Talking about making a grand entrance.
So if you think about complexity, it looks chaotic on the surface, but there's a healthful aspect to it. Versus chaos is a form of activity that is not responsive and not organizing. Complexity is responsive and organizing. Chaos is not. Chaos can have aspects of rigidity. So in brainwave patterns, there may be rigidity in certain brain waves when there is a chaotic pattern. And what neurooptimal does is it restores healthy complexity in the simplest and very safe way based upon what your brain tells the machine. So I'm not sitting there trying to figure out what right pattern do you need. Your brain's telling you the equipment. And we've had just wonderful responses. Next. So I'm going to stop, and we're going to have a lot of give and take on this, but I'm going to let Carrie hold forth on the issues that she's works on in terms of detoxification and her herbal approach.